So our next lecture is about emerging and re-emerging zoonotic diseases. So till now what we have discussed is definition of zoonosis. What are zoonoses? So zoonosis zoo means animal, nosis means disease. So these are the animal diseases which are going to human. So from animal to human. These are the animal diseases going to human. Okay. So out of these animal diseases, what is the percentage that is going to the human? Means human infectious disease from this group which are coming from the animal, they are 60%. Means 60% are zoonotic disease. Remaining 40% they are not zoonotic. Remaining 40% are not zoonotic. Their source may be vector-borne, waterborne and some other sources. So in zoonotic lecture, we'll focus mainly on this data 60%. So these are the diseases of the animal and these are moving to the human and their percentage is 60%. 60% means every year if 5 diseases are coming to human, then 3 diseases are zoonotic. So 3 out of 5. So 3 diseases from this pool, out of 5, these 3 are coming from the animal. Remaining 2 may be coming from this side. So these are the animal diseases. So which animals are involved? Which animals are involved? So animals may be reservoir, that is their natural host in which they remain asymptomatic. Animals may be intermediate host. These are the amplifier and from here they are moving to spill over to human being. So from the animal to the human, 60% zoonotic diseases. From the bat itself, there are so many virus diseases going to the human being. For example, this is the reservoir, this is the natural host. From the bat to the intermediate, from this population, the animal is horse. Then from the horse to the human, Hendra virus is going. So this Hendra virus is zoonotic disease that is mainly a part of animal disease. Then from the camel, MERS, that is Middle East Respiratory Syndrome to the human. From the pig, Nipah virus. And about the COVID-19. COVID-19, this intermediate host or the amplifier host or this animal population is still question mark. Means we don't know which animal reservoir or amplifier is this. So it is not found, not identified. So this COVID-19 whose etiological causative agent is SARS-CoV coronavirus 2. This COVID-19, today it is known as emerging infectious disease of probably animal origin. Probably animal origin. Then from dog to human, rabies. Monkey to human, Ebola virus. Then waterfowl or duck, birds, then birds to human, that is H5N1. So these are the animal diseases which are going to the human. How many diseases? 60%. So 60% are known as zoonotic diseases. As per the WHO definition, from lower vertebrate animal to man, zoonosis. In reverse also, the definition itself say in between these two. But most of the zoonotic diseases are from the vertebrate animal to man, mostly. So from animals to human. What is the percentage? 60. Remaining 40 may be non-zoonotic. and 3 out of 5, 3 are zoonotic, remaining 2 may be non-zoonotic. And what is involved? Animals are involved. So zoonosis, that is, these are the animal diseases going to the human. And what animals are involved? That may be the reservoir in which the causative agents survive but do not cause disease in the reservoir. Then intermediate host, that is also known as the amplifier, where causative agent multiply, more susceptible. Then from this intermediate host it moves to the human or spill over to human. So this was the meaning of zoonosis, animal disease. This was the meaning of 60%. So coming back to emerging and re-emerging concept. From this group, suppose this portion, these are the emerging infectious diseases. Emerging infectious diseases, 75% are zoonotic. 75% are zoonotic, going to the human being. And this portion of animals, this much portion is the wildlife. This is the wildlife. So wildlife means free ranging or undomesticated mammals, birds, reptile, then amphibia and fishes. So 75% of the emerging infectious disease are zoonotic. Remaining 25% of the EID, emerging infectious, they are non-zoonotic. So from this pool, if they are emerging infectious disease, only 75% are going to the human. And out of that 75% data, a major portion is coming from the wildlife. Major portion is coming from the wildlife. The remaining portion may be domestic animals or birds. So emerging infectious diseases, this pool is emerging infectious diseases. From this, 75% going to human means 75% are zoonotic, in which the major portion is coming from the wildlife. And wildlife means free ranging or undomesticated mammals, birds, reptiles, amphibia, fishes. And the remaining 25% is non-zoonotic. So we'll start the definition and the difference between emerging and re-emerging. Emerging and re-emerging zoonotic diseases. So what are emerging diseases? Emerging means they are the new disease. They are newly evolved, or they are apparently new agent, means they are coming for the first time. So they are the new one. Re-emerging are old diseases. These are the old diseases. In previous time they were known, then they declined, and after a gap of some decades they again reappear. So these are the old diseases. These are the new diseases. So these are the key points for your multiple choice questions. So first line says these are the new agent. Second is these are the previously unknown. UK means unknown. So these are the previously unknown agent which are detected first time, or these could be previously known agent. This could be previously known agent, but they shows increase in incidence during past 2 decades. These are the previously known, which shows expansion in geographical area, host and vector range. Means these are the agent which are previously known, but what they are showing, expansion in the geographical area. From one state to, they are spreading to different states, or within a state they are spreading in different area, or they are changing their host. Means for example, avian influenza, from waterfowl or duck to birds, now they are changing their host from birds to human. So, and even vector range, they have increased their vector range. Previously known agent appearing in previously unknown places or unknown species. Means these are the previously known agents, now they are coming in unknown places or unknown species. So what is the meaning of these two terms? We'll see with one example, that is example of KFD. Example of KFD. KFD first case was reported in 1957 in Shimoga district, Karnataka. So the case of the KFD, it was first time reported in 1957. So KFD, Krasnor forest disease, first case was reported in 1957 from Shimoga district, Karnataka. During 1957 to 2012, this period, the disease was confined to Shimoga and some adjoining areas. But from this 2012 to 2020, this period, during this period, this KFD virus, it shows its expansion in geographical range. So this KFD during this 2012 to 2020, it shows expansion in geographical range. Means this KFD expanded to Kerala, Goa, Maharashtra and Tamil Nadu. So in 2014, some cases were reported from the region of Kerala. In 2015 from Goa, 16 Maharashtra and 2019 Tamil Nadu. So from the original place, it shows its expansion in the new geographical area like different states. So this is previously known, this KFD was previously known PK, that it was limited to Shimoga and adjoining area during this period 1957 to 2012. So previously it was known, but it started showing its expansion in new geographical range, new geographical areas from this to this period. Like from Karnataka, it expanded to Kerala, Goa, Maharashtra and Tamil Nadu. So this is the definition of the emerging diseases. So what are emerging diseases? Emerging zoonoses are those diseases which are apparently new agent, which are caused by apparently new agent, or which are previously known agent. Now they are showing expansion in geographical host or vector range, or these are the previously known agent which are appearing in previously unknown places. This Kerala, Goa, Maharashtra, Tamil Nadu, these are the PUK, these are the previously unknown places where this KFD was not there. This previously known agent means KFD virus, it was there but it was in the Karnataka, but in these places it was absent means these places are previously unknown places for the KFT virus, but this previously known KFT virus, it shows its expansion to these areas. So this is the meaning of this line or the terms as per this emerging zoonosis definition is concerned. Then re-emerging, these are the old diseases which re-emerge means they reappear after some times. For example, human plague, previously known, PK, human plague was previously known. Then it started decline. Why it started decline? Because of treatment with antibiotic, immunization and some other kind of treatment. So with treatment or medical intervention, the human plague cases started decline. So at this point, 1966, last case of human was reported. Last case was reported at the end of the decline, 1966. Where the last case was reported? It was reported in Karnataka, district Kolar, the same district which is in this district the KGF movie is based, Kolar Gold Fields. So in this Kolar district, one area is known as Mulbagal area. So in Mulbagal area, Kolar district, last human case was reported in 1966. After this 1966, 28 years gap. This gap means in this period, 28 years gap or this period, there was no case reported of human plague. Then after this 1966 plus 28, that is 1994. Here in 94, this human plague reappear. It re-emerged in new geographical location. So which was the new geographical location? We'll see. Then why it re-emerged? There could be so many reasons, but what is given in the books is the reason is breakdown in public health measures. So why this reappear? Because of breach or breakdown in public health measures. It reappear in two epidemics which occur in two different geographical area. One epidemics happened in Maharashtra, one in Gujarat. Total case diagnosed were 876. In Maharashtra, Bid district, and in Gujarat, Surat district. In Bid district, B for B, bubonic plague was epidemics was of bubonic plague, and in Surat it was PP, pneumonic plague. So total fatalities in these two epidemics were 54. 2 cases died in Bid, that is because of bubonic plague, and 52 cases died in Surat because of pneumonic plague. So these were two new geographical locations, Bid and Surat, where the disease reappear in 1994 because of breakdown in public health measures, where the fatalities were there, 54 fatalities. So what we have learned in re-emerging diseases, these are the previously known agent. Because of human medical intervention, treatment, chemotherapy, immunization and all, they declined. Then last case reported, then a gap of some decades, like 28 years means around 3 decades. Then because of breakdown in public health measures, they reappears in the form of epidemics. Epidemics means sudden rise in the number of cases. So this is how the human plague re-emerged. That is previously known, significant decline, then gap, then reappear. Okay, this was the human plague. We'll see what happened in reference to cattle plague. Cattle plague means rinderpest. So rinderpest was previously known, then it declined and gap. But in case of rinderpest, there is no reappearance. Means if this is the place where the last case was reported of rinderpest, then this period is the gap period, but till now there is no re-emergence of rinderpest. For example, so cattle plague, also known as rinderpest, previously it was known, then it declined because of immunization or vaccination. Because of vaccination, because for viral diseases there is no treatment, so because of vaccination this rinderpest declined. Last case was reported in 95, and that was from Tamil Nadu, North Apricot district. So last case was reported in 95. Then in 2004 India became free from rinderpest. But in May 2006 OIE declared India as free from rinderpest in 2006. So internationally it was recognized as free from rinderpest in May 2006. Global eradication or global level, world level, when it was declared or announced as free from rinderpest, that was 2011. So in 2011 FAO declared or announced that there is global eradication or world level eradication of the rinderpest. So these four are your MCQ. That last case of rinderpest was reported in 95. When India became free, 2004. When this OIE International Committee, it recognized this India as a free from rinderpest, May 2006. Or when it was eradicated according to OIE, 2006. And from the world or global level, eradication of rinderpest, that was announced by FAO, that date is 2011. So from 95, the last case, and till today 2025, this rinderpest virus, it comes in this period, that is gap period, means 5 and 25, 30 years. This gap is 30 years, means almost 3 decades it's been over. There is no single case of the rinderpest from India, means there is no reappearance and re-emergence till date. If in future, suppose in 2026, if sudden epidemics comes, then this rinderpest will be called as an re-emerging disease, reappearing disease. Why? Because this was previously known, then it shows significant decline, then last case reported, after that 30 years over gap, then suddenly epidemics happened or it re-emerged or reappear. So what are the examples here? Human plague. In the case of emerging diseases, Other example, so these are few examples of emerging zoonoses. First, from the influenza viruses, like in 1997 H5N1 avian flu was first case was reported. In 2009 swine flu H1N1 it was reported. So these are the emerging zoonoses. Then from the coronavirus, before 2002 these coronavirus were known to cause common cold in human. In 2002 the cases of SARS were reported. Then 2012 MERS, that is your Middle East Respiratory Syndrome. Then in 2019 COVID-19, that is caused by SARS coronavirus 2. So these are the few example of emerging zoonotic diseases, and these emerging zoonotic diseases are 75% are zoonotic from animal to human. Rest 25% are not zoonotic. And here human plague one example, and second example is the KFT. Now it is recognized as a re-emerging disease. So this was all about emerging and re-emerging zoonotic diseases, the difference in their definitions with the examples, and re-emerging with two examples, human plague and cattle plague.